We're excited to chat with Dr. Jason Maljaars, neurologist with St. Francis Health and medical director of the St. Francis Stroke Program. As a neurologist, Dr. Maljaars is particularly passionate about the impact of nutrition and food beyond just how it affects your weight. He has a wealth of knowledge on how the food we eat impacts our brain health and our cognitive function. And you'll hear him mention the Mediterranean diet, which is highly endorsed by physicians as one of the world's healthiest diets. Listen for his explanation of insulin resistance and its effect on the brain and the concept of brain metabolism as well. In our discussion, he shares helpful tips for what foods are healthy for your entire body. And one key message was there is not an inevitability to a majority of the conditions that we face, and we can really make a difference in our own lives based on the food we eat. So really excited to dive in and share this conversation. So let's get to it. Welcome, Dr. Maljaars. We really appreciate you joining us. I'm really excited to talk to you about how the food we eat impacts our brains.
You're welcome. Thanks for having me. So I'm originally from West Coast Canada. I was born in British Columbia and decided to go into medical school. I went offshore for school. I went to a school called St. George's University in Grenada. I studied for a year in England first, and then a year in Grenada, and then 2 years in New York City. And then I did my residency in neurology at University of Iowa, and then a stroke fellowship there. And I knew kind of from early on in medical school that I wanted to do something in neurology, something with the brain. I was quite naive actually as to what a neurologist really did day to day, but I just knew that the brain was, fascinating, mysterious, and endlessly interesting. So that's kind of what led me into that field. And as I, sort of trained and got sort of specialized in neurology, I really enjoyed it. I liked stroke because it makes a lot of intuitive sense. It's a bit like plumbing in a way. And it's also emergent, and I really enjoy emergencies. So I did a neurology residency is 4 years. I did an additional year of stroke fellowship just to kind of get specialized more in that area. St. Francis, working here, was my first job at practicing independently, and it's been a real privilege to be part of this healthcare system and this particular opportunity. The missions are very in line with what I was looking for, but also the chance to come in where there wasn't there was a real need for neurology, and to be able to build up, with the team here, the stroke program and everything, has been very satisfying. But I've always had an interest in thinking a little bit more about how we get the diseases that we develop and that we see, our patients developing, as opposed to how can we treat the symptoms? Of course, treating the symptoms is a big part of everything, but I've always been interested in why do we get these in the first place? What's the root causes? And so that's kind of led me to, sort of really look into the nutritional causes of diseases, and sort of really, especially since I finished my formal training, to really have some time to delve into that. And that's been my area of interest for some time now.
That's awesome. I'm curious, you've worked in so many places. What sparked your interest in coming to Louisiana? Yeah,
I get that question a lot, actually. But it's basically, my wife is from New York. We met, she's a nurse. We met there. We moved to Iowa for those 5 years of training. And then as a Canadian, I was on a visa that required me to work in an underserved area for some time after I finished my training. And then we also wanted to move south, just for various reasons. We wanted to be in the south. And so actually the call from the recruiter about this position was, kind of out of the blue. I had not, had Monroe, Louisiana on my radar per se, and was, of course, Googling it while the recruiter was talking to me about the position. But ended up, I interviewed. Of course, there's plenty of need, and I had a few opportunities, but the people here were just very special, and it was a very, it wasn't a difficult decision at the end of the day to decide to come here.
That's really great to hear, and I'm surprised you wanted to be in the South. How has the weather fared for you? Are you enjoying the heat? Has it been a surprise or pretty much what you expected?
I heard it was going to be very hot, and indeed it is. But what helps a lot is, in the Midwest for 5 years, the winters were basically from, kind of mid-September to, it could still snow in May.
Yeah.
And that was difficult. And so I instead of calling it heat, I sort of thought about it as warmth instead. And that's been sort of helping me, It's just like, it's hot, but it could be 8 months of winter in other parts of the country. So I'm okay with it.
That's such a positive perspective. I'm born and bred Southerner, so it's hard for me to think about it positively about the heat of the summers. So diving back in on your specialty, can you help our listeners understand neurology and really what does a typical day in your life look like as a neurologist?
Sure. So one of the common things that when people ask what I do and I say I'm a neurologist, they think I do surgery. And actually, neurosurgeons are, that's a very different career than neurology. So neurosurgeons are, as you imagine, they do surgery related to the nervous system. But a neurologist is non-surgical and treats any kind of condition that affects the nervous system, the brain and the spine and the nerves. So that could be strokes, and actually strokes are the most common neurological condition for hospitalized patients. But it could also be headaches. For example, headaches are the most common condition that someone will see a neurologist for in an outpatient clinic setting. And then there's dementia, there's multiple sclerosis, Parkinson's disease, and a host of other conditions. Seizures is another very frequent problem. So I work as a neurohospitalist, which is a relatively new kind of career. What that means is, as a hospitalist, that infers that I work in a hospital setting as opposed to a clinic. And I see, patients that are admitted with any kind of neurological concern. So again, strokes, seizures, and all sorts of other things. And then in addition to that, I do have some clinic as well, an outpatient setting, where I'll see a few of some of my follow-ups from the hospital, and I'll also see some new referrals from the community.
Well, like we mentioned, really interested in the link between food and neurological conditions, and know it's a really big interest for you as well. Could you walk us through that connection and how our diets can impact our brain and brain function?
The impact of nutrition on our brain health is tremendous and very complicated, obviously, as anything is when you're talking about, in the human body. Like I said, I've always had an interest in why we develop the conditions that we do. Is it simply just kind of a luck of the draw, or, is it just all down to genetics or something like that? Or is there something more, going on, perhaps something that we're doing to ourselves? The biggest impact, driving factor in neurological conditions, and many neurological conditions, is ultimately what our bodies are exposed to. And that is, of course, primarily what we are eating. So in sort of a nutshell version, the history of how we got to the dietary recommendations we have currently, which are, put out by the federal government every 5 years, and have typically been largely unchanged since the first iteration of that in 1980. What happened was the dietary recommendations were primarily focused on heart health and diet, and kind of, as opposed to brain health and diet, or weight gain and diet, et cetera. And there are, of course, all sorts of different diets and different, different lifestyles of eating, et cetera, out there. But the question is, how does that factor in? How do those nutritional guidelines, which, by the way, most people do generally follow. It's not that people have largely ignored that. In fact, people really have, like I said, have said, well, margarine is better, canola oil is better than using lard, for example. So the question is, how does that factor into neurological conditions? And that requires, a bit of understanding of how the brain is affected by diets that are higher in carbohydrates, sugars, these oils. And that's so we would need to then talk about a little bit about brain metabolism and how the brain response to that kind of diet.
I'd love to hear you talk more about that, because what I'm hearing from you is that a lot of the recommendations on food are centered around how to keep your heart healthy. And I think where you're going with this is with brain metabolism, is that there's so much information out there, like seed oils are bad, you're not supposed to eat them, look out for these other ingredients. And are there certain foods that are good for your brain to keep cognitive function? Also, is there a diet that can help with your whole body health, or do we have to eat for just parts of it? I really appreciate you shedding light on this, because it's so frustrating for so many people, including me, and to know what's healthy to eat, what's not healthy, and what things we really need to avoid. It's so much to try to follow and keep up with.
If you think about it sometimes from a kind of like, what are we supposed to be eating? It starts to actually get a bit more simple. Some people say if it didn't grow in a plant or have a mother, then, you probably shouldn't eat it. There's really, I do think there are simple ways to look at it, because there's so many different opinions about what to eat. And there's so many different, types of diets. And of course, social media has only just played into that more. It can get very confusing. It's like, what do I eat? And what supplements do I take? And should I be just drinking, shakes made out of powder from the grocery store, or should I eat like steak and eggs? It's hard to know. So that's one kind of rule of thumb that I have sometimes, I usually give my patients just to help them sort of simplify the whole thing.
That's really great advice, because when you do stop and think about it, of course, anything that is manufactured outside of nature may not be something that I should really be eating or eating frequently. And so I kind of want to double back a bit, because I really did get excited when I heard you say the phrase brain metabolism. And it sounds like an interesting topic, and would love if you could explain that in more detail.
Yes. So to speak simply about brain metabolism, the brain can use two sources of energy. It can use glucose, which is like what we call blood sugar. That's what we check, if we're diabetic, for example, checks the blood sugar. And it can use something else called ketones. And ketones are another form of energy that your liver produces. And your brain likes both of them, and it likes to have both of them if it can. Sometimes actually it will even prefer the ketones over the glucose if given the choice. But having a bit of both of them available is important. Now, your brain, to metabolize glucose. So the glucose, there's a barrier between your brain and the bloodstream called the blood-brain barrier. So it protects the brain from anything that might be in the bloodstream that's not healthy for the brain. Glucose, moves across to the brain quite freely. But the brain needs another signal to use that glucose and to metabolize it and to use it as energy and to flourish. And that signal comes from insulin. And we think of insulin as a kind of a blood sugar control hormone. It's a hormone produced by the pancreas, and it's produced every time we eat. But it's produced in kind of in levels, different levels depending on what we're eating. So if we're eating white flour and regular potatoes and white rice and sugar, for example, we're getting a huge amount of blood glucose, and so our insulin goes up very high. If we're eating protein, we're getting much less, in response to the proteins that are being digested, insulin doesn't go up as much, and with fats, it goes up hardly at all. So the insulin needs to get across that barrier to the brain and tell the neurons basically to metabolize and flourish. And it does so by a transporter, a special protein that it basically attaches to and gets sent across. The problem with the standard American diet, which is very high in carbs, very high in sugar and artificial sweeteners, and very high in these seed and vegetable oils, the problem is that the insulin levels in our bloodstream are always elevated. So rather than insulin kind of going up after we eat and then dropping, and then going up again and then dropping, like, for example, all the way overnight and almost at zero, in the morning and then coming up again when we eat, our insulin levels are kind of always elevated to some degree on average. And what happens, what your brain does, what often happens in the body when you have a signal and a receptor for that signal, is if that signal is always elevated, that receptor starts to stop responding to it, because that's kind of the new normal. So instead of seeing signal and then nothing, signal and nothing, you just get signal all the time, and the receptor stops responding. So what happens is that transporter that's supposed to move insulin across the brain, across the blood-brain barrier into the brain, it gets resistant to the insulin levels, and it stops working properly. So you get less levels of insulin in the brain, which means your brain can be swimming in a sea of energy, but cannot metabolize it because it's not getting the signal to do so. And specifically in the hippocampus, that's a part of the brain, kind of deep in the temporal lobe on both sides, involved with forming memories, that the hippocampus is very sensitive, and it really needs surges of glucose metabolism when it's making new memories. And so if your brain has been seeing high levels of insulin for years, for decades, it's gotten resistant to that. It doesn't have the levels of insulin in it to kind of capitalize when you're trying to make a new memory and you got a surge of energy requirement. It just isn't there. And so the memory doesn't get made. And so that's one kind of example how what we eat leads to impaired cognitive function.
You've definitely got my wheels turning. I'm wondering if it could be considered a form of insulin resistance and metabolic disorder as well, right? Are they all connected in that space?
Some people do call Alzheimer's disease, which is the most common form of dementia, type 3 diabetes. Diabetes, meaning if it's type 2 diabetes, the kind that develops in adulthood, that is due to resistance to insulin as well, affecting the body, affecting the liver and the rest of the body. But you don't necessarily have to be diabetic at all to have a level of insulin resistance in the brain. But of course, the two do often go together. And for example, somebody who has type 2 diabetes, who's resistant to insulin kind of throughout the whole body, is going to be resistant at the level of the brain and has a much higher risk of developing dementia in their life than non-diabetics, for example.
Wow, that's fascinating. Insulin resistance is a topic more and more people are talking about, and people who are insulin resistant but may not be type 2 diabetic, are there things that they can be doing now to help strengthen their cognitive function or to help? I don't know if reverse is the right word or if that's even possible, but are there things that they can do to get them on the right track so they can optimize their brain health, but also their physical health?
Yes. So back to your point again about like, what do I eat for what? Like you don't have to, think about, well, I got to eat like one type of way to optimize my brain, but maybe to the sacrifice of my heart or something like that. I mean, it isn't like that. Again, we are created with everything we need to thrive. So it does work when you eat right. So one of the key things, again, back to the miracle of our bodies, they're so resilient and so capable of resisting insults and healing themselves that pathology in the brain, for example, can go on for decades before you finally have symptoms of a neurological condition. So if you're eating in an unhealthy way, in other words, kind of the higher carbohydrate, high sugar diets, and by the way, artificial sweeteners actually spike your insulin levels. They don't spike your blood sugar, but they spike your insulin levels more than sugar does, actually. So that's how they can be worse for you, or they are worse for you. If you are consuming this kind of unhealthy diet for decades, your brain can tolerate it for a while. It can tolerate it for a while, but eventually it's not going to be able to tolerate it. And there's, of course, multiple factors at play. You can have a husband and wife who have exactly the same diet and lifestyle for 65 years, and one of them gets dementia and one of them is sharp as a tack. So there's definitely more going on, including genetics. But one of the main things that to know, and one of my sort of missions is to try to spread this knowledge as much as possible, is that these kind of conditions are not necessarily inevitable or kind of it might happen to you, it might not. You just sort of have to wait and see. Maybe your mother had dementia. Can you expect it yourself? Again, there's some genetics that play a role that you can get some sense of prediction. But at the end of the day, the pathology is slowly accruing over time, largely based on what we eat. And that infers, obviously, that if we optimize our diets, we can stop the pathology from developing.
I want to shift gears a little bit into this next question, which is about specific types of diets that we see as sort of the gold standard, so to speak. So the Mediterranean diet being one of those, and how that diet specifically can help you maintain a healthy lifestyle. Tell me more about that diet and how it impacts your brain and why it's become so highly endorsed by so many physicians.
Sure. The Mediterranean diet is definitely a major improvement on what was preceding it. So what was preceding that was the food pyramid we talked about, which was very high carb and very low fat. And then the fats recommended ended up being quite unhealthy, like the canola oil, soybean oil. The Mediterranean diet itself has a very interesting history, by the way. It was developed kind of in the late 80s and the 90s where there was a particular interest from the folks who were looking at diet and heart disease. They noticed that some of the people in the Mediterranean area seemed to have high fat intakes, but low risk of heart disease. And they had a lot of olive oil. And so there was a kind of an interest, and there were two physicians, one from Greece, one from Italy, who really took this up and sort of said, well, it must be the olive oil that's good for us. And indeed it is, extra virgin olive oil. It's worth noting, by the way, that about 70% of the olive oil in the grocery store is adulterated with seed and vegetable oils. If it's in a clear plastic jug, for example, it's not going to be pure olive oil. If it's in a dark glass container, it most likely is. But these two physicians kind of drove this notion. It must be the olive oil. There must be something the Mediterraneans are eating, and the Mediterranean diet sort of took off. And again, it was an improvement on things. The way the Mediterranean diet is essentially a lot of fresh fruit and vegetables, a lot of fish and lean meats, and then lots of olive oil, and then it does. So those are the good things about it. Especially the olive oil does seem to be quite particularly helpful for all kinds of conditions. But it does. So it's only ever been compared to the standard American diet, which is very high carb, high sugar, and unhealthy oils. Sort of imagine your burgers and fries and the soda and the candy and that sort of thing. It's only ever been compared to that, and it's always been shown to be better, somewhat intuitively. So is it the best possible diet we could eat? We don't know. Will we ever know what the best possible diet is we could eat? Probably not. These kind of studies are basically impossible to do, just because of how sort of bulky and long lasting, et cetera, they have to be. But we do our best. And so it is advisable. I mean, I do recommend the Mediterranean diet to my, to a lot of my patients.
It's interesting that you say we've only really compared the Mediterranean diet to the American diet, because that was going to be my follow-up question. Is there anything we are getting right in the American diet at all? Because I think we do tend to look to other cultures and try to see what they've gotten right and see how can we apply it to our own. And I'm curious, is there an example of something that we do right in the American side, on the American side, when it comes to our diets?
Oh, that's a good question. Are we getting anything right in the standard American diet, or the SAD for short? Well, it's too high in carbs, so no. It's too high in sugar and artificial sweeteners, so no. It doesn't allow for the healthy fats, or I should say it discourages us from eating healthy fats. So it's kind of failing there. Vegetables. I think the standard American diet doesn't include vegetables per se, but we don't discourage, obviously, eating vegetables. So that's perhaps something that we're getting right. But there's a lot to be improved on, and I think that it's not a matter of, for example, opinion. It's not a matter of like, well, I think it's probably better to eat whole natural foods because, for example, I'm a Christian. I just believe that that's what we're supposed to be eating, and it's not a matter of opinion or whatnot. I mean, the evidence behind eating whole, unprocessed, naturally occurring foods is very strong, and it actually has always been there. But it's hard to say, for 60 years, this is how you got to eat. You got to eat lots of carbs, these kind of manufactured oils, and stay away from the butter and the eggs and the steak. And then to one day say, well, you know what? We actually got it completely wrong. Turns out that the steak and the butter and the eggs are better for you. So that's a hard thing to say, with a lot of interested parties, obviously, that would rather that didn't get said anytime soon.
Yes, it's definitely become a big food industry thing in the States. And I think that's also why it's so important to educate ourselves on these topics. And also those little nuances you mentioned. Yes, this diet is good, but it's only because it's compared to a worse one, or because we don't know enough history about it. And you mentioned something earlier about dementia and Alzheimer's. I have a history of that in my family, and I'm sure many others who are listening or watching do as well. And I know you said some of it is genetics that play a part, but it also sounds like there are things that we can be doing to help ourselves stay healthy and keep our cognitive function. What are those things that we should be focusing on to keep our minds healthy and strong? And even down to the food we consume, how does that play into keeping our minds healthy and strong as well?
Yeah, that is very important. And so I will just quickly say that I don't think that necessarily there's anybody that's inevitably going to develop, for example, Alzheimer's, but you can't change your genetics, so you may have a higher risk. But I think one of the most important things for people to know is that you can, do things to prevent these conditions, even if you have a strong family history. I mean, I have a family history myself. There are very few people, these days that don't know somebody who has some kind of cognitive impairment, if not dementia, or has passed away from that. So this is a major problem that's getting, bigger as our, population ages. It's just a huge problem. And obviously for the patients themselves, the people themselves who are, developing these conditions, and especially as they become more advanced, they're caretakers, so for every one person with dementia, they'll have several caretakers, family members, et cetera, who are, just as impacted and ultimately more so. So it's a major problem. We have long thought about dementia through a fairly narrow lens, which is that there's this abnormal protein that deposits in the brain for some kind of reason. It's called amyloid. And if we could just invent a drug that would get rid of the amyloid, we would stop the, Alzheimer's problem. And you have to ask yourself, what's the underlying cause? Why are we getting cognitive impairment? And that, again, is a very complex process, but it needs to be thought about as it's multifactorial. It's all kinds of things that our brains are subject to, our diet being the biggest part of that, but also chronic infections, black mold in your home, toxins in your laundry detergent, air pollution. I mean, all these different factors, stress and sleep, poor sleep, and your brain basically over time, subject to that, it kind of goes into a protective type mode. And that's kind of where we see that abnormal protein being used by the brain almost as a protective sort of mechanism. That's why that protein is related. But it's protecting itself against these multiple factors. And so the way to think about managing, the symptoms or treating the underlying problem, or of course, much more optimally would be preventing it in the first place, is to say, okay, what are those factors in my life, in your life, in my patients' lives, which are going to be a little different for each person, and say, how do we address each of these, and how do we reduce that onslaught of unhealthy environment that your brain is having to struggle through, and then how do we give it what it needs, right? So what I end up doing, I mean, there's you can check vitamin levels and all sorts of different blood levels and all that kind of stuff, but the primary change that I can make in my patients currently, just kind of the average person coming in for the average appointment, is to change what they eat, and it has everything to do with that insulin that I talked about. I shouldn't say everything, but it has a lot to do with the insulin levels I talked about. Changing your diet so that your insulin levels not always elevated all the time, and eating a diet that allows insulin levels to be dropping to again, close to zero for periods of time, is a big part of it. So the things that drive insulin up are carbohydrates, sugars, artificial sweeteners, primarily those things. So you reduce those or you get rid of them, and then you give your brain what it needs. And your brain is actually about 70% fat, and it desperately needs good quality fats to function properly. It needs adequate cholesterol levels to be able to function properly. The nuances of cholesterol metabolism is another thing, another sort of line of interesting history we could go down. But ultimately, it's back to the sort of nutritional factor of all those factors that are affecting the brain. The more that you can change your diet that way, getting rid of those things and giving your brain healthy, food to eat. So that would be whole, naturally occurring foods, things like fresh vegetables, primarily. Fruit is fine, but not in huge amounts. Plenty of fresh vegetables and plenty of healthy, proteins and fats. Fish is very good. Cleanly raised, so preferably not factory farmed and antibiotic infused, et cetera, beef and chicken and whatnot, but cleanly raised, animals raised the way they're supposed to be raised. Eating meats, not being afraid of butter, not being afraid of other naturally occurring fats, coconut oil, avocado oil, olive oil, et cetera, gives your brain what it needs to flourish. And so that's kind of where I go when I treat my patients from that perspective.
Thinking about the typical diet rules of calories in versus calories out, and we know calorie counting and being mindful about what you eat is pretty standard practice in monitoring food intake. And so when looking for the balance of eating whole, natural, occurring foods and avoiding the manufactured ones, is it better for you to have things that are denser in calories if they are good, healthy fats, whole food ingredients? And what is your take on that? Thinking about those fats that are high in calories, like olive oil, avocados, those types of foods.
Absolutely. I think the calorie thing is somewhat of a fallacy. All you have to do is think about this. If you're going to eat 1,000 calories of broccoli or 1,000 calories of Mountain Dew, are those going to affect your body the same? Right. And it's just we have been told and sort of been believing that the way to think about things is energy in, energy out, right? The way we gain weight is because we eat more than we exercise. It just isn't. It just completely avoids the whole complexity of metabolism. And calories are all they serve as is a measurement of the potential energy in your food source. They don't tell you anything about how it's going to affect you. So I never worry about counting calories with my patients or myself. And I do practice, what I preach to my patients, but it's very much about the nutritional content of what you're eating. So
we've one term that I think that has become, I guess, more frequent or kind of been coined, especially after COVID, was the term brain fog. And I hear it used so frequently just on social media, online. Can you tell us, what does this mean? What does that mean? Is that actually a medical term? Is it caused by food we're eating? Is there a link there to weight, lifestyle factors? Is it reversible? Can you tell us a little bit or talk to that kind and maybe even demystify maybe some of the brain fog there?
Yes, brain fog has been a common complaint, especially after COVID, especially with people, of course, who had, COVID or maybe long COVID. So it's in a way, it's not exactly its own official medical term, but it does fall under that, neurological outcomes of having sort of long COVID or sequelae of having COVID, which, of course, as we all know, affects people radically differently. So it's a tough condition to see as a neurologist because it's typically it's one of there are very few conditions in neurology that you do something and the problem goes away. The next time you see the patient, it's very difficult to take care of these things that way, which is just partly because the brain is just so extraordinarily complicated. But what I recommend if I see anybody who has kind of this somewhat non-specific collection of symptoms, chronic fatigue, not really able to concentrate properly, just a little bit less, energy and enthusiasm and things, and just can't quite, do what they used to do. I had somebody, for example, stop me in the hallway just the other day and ask me that very much that, this is my family member, this is what they're experiencing, what do you do? And I think we can never underestimate how much our diet, what we eat, is affecting our health. So the first thing I recommend is, in these kind of cases, is to try an elimination diet. And most of the time, this is, if you have other unusual, healthcare conditions, et cetera, it might be something you want to run by your primary care doctor first. But in general, elimination diet, there's two ways you can do it. You can either take out one thing from what you currently eat and keep doing what you're doing. Or what I usually do is I usually say, for example, go a month with no sugar, definitely no artificial sweeteners, no gluten, because gluten actually seems to affect a lot of people neurologically without actually having the classic GI, stomach upset issues. So go without those things, for a month and see what happens, and if nothing happens, and if you can do it, maybe take out dairy while you're at it and just see how you feel, and I've had people with migraines and various other conditions that can get, just really significant improvement of their symptoms just by, getting rid of something. And maybe it's something they ate all their life and they tolerated it fine. It's just for whatever reason, post-COVID or whatever else it may be, they just can no longer tolerate this particular thing in their diet. And it seems to be the direction to move in typically is, and again, this almost sounds like a little bit like heresy to say it these days, but the direction to move in, if you're going to do an elimination diet, is you should center everything around meat. The meat should be what you keep in your diet. And if you really wanted to go, somewhat extreme, I would say, like if someone said to me, I'm only going to eat one thing for a month, what should it be? I would say red meat. Eat red meat and make sure it's raised properly, right? So make sure that that's a cow that's eating grass and living the way it should be outside. It's not pumped full of, different chemicals and drugs and everything. But eat red meat and make sure you eat the whole thing. Don't just eat muscle, but eat some of the fat and eat also the organ meat, the liver and heart, et cetera, because that has nutrients that the rest of the animal doesn't. But we can thrive off of that. I mean, we know, and there's been cultures, in history, the Inuit, for example, in northern Canada, or the Maasai people in Kenya, for example, that eat nothing but meat and animal fat and have none of the chronic diseases that we have, like not one. So if you really want to go out there and just say, I'm going to do the strictest elimination diet I can do. That's what I would do. I would say, go for that.
Wow, that's really insightful. And I'm thinking to myself, I've always normally just eat chicken. I'm like, okay, I guess I just need to eat more red meat in my diet, but know that it really, really is helpful. And I realize too, even for listeners who maybe haven't heard the term brain fog, I want to kind of circle back to that. Can you just quickly run through brain fog symptoms or what you might experience with brain fog? What does that feel like for those who maybe don't know or maybe haven't even heard the term?
Yes, brain fog is, again, it's a little bit kind of vague, and it's one of those conditions that's hard to sort of really put in a box and say this and not that, et cetera. But it typically has to do with the main thing is concentration abilities. You just cannot focus on what you used to be able to. So, for example, you might be trying to read something and you just cannot get through a paragraph without realizing that you don't even know what the first sentence was. Or you might be having a conversation with people and you realize that you cannot remember what they just told you. And you kind of have this inability to really sort of lock on to one single subject and focus on it. And it typically comes along, so that inability to focus typically is associated also with general fatigue, low energy type of thing. So you don't feel like you could just go out and conquer the world today. I mean, but I have brain fog, but otherwise it's typically that goes together, that lower energy and again that lack of ability to concentrate, which is usually distinctly different from the way you used to be. So of course, to notice that. I mean, people struggle with their concentration, especially in today's age of distraction. But if you notice that definite difference of trouble with focusing combined with low energy and fatigue, and just knowing that you're not yourself, which is, again, kind of like how a lot of people describe it. It's hard to say it sort of in specific terms. Something isn't right with my ability to go through life like I used to.
That's why it's so important to listen to your body cues so that you know if something's off, or to focus on things so you can bring it to your physician. Before we go, is there anything, like one key message that you would want to leave our audience with about diet and brain health? And if there's one key takeaway that you'd want to make sure that they walk away with, what would it be?
Yes, one key takeaway from all this, through all the complicated metabolism stuff, the different diets, all that kind of stuff, is if we eat the way that we're supposed to, which is whole, unprocessed, naturally occurring foods, we can not just prevent a lot of the diseases that we suffer from, but also treat the ones that we are currently suffering from. So there isn't an inevitability to the majority of the conditions that we develop. We can absolutely make a difference in our own lives based on paying attention to what we eat.
That's really such great advice. Thank you so much for joining us, Dr. Maljaars. We've learned so much, and we are so grateful for you sharing your expertise and your time with us.
Thank you very much. It was probably a bit disjointed at times. That's just because I have so much to think about and say. But yes, I really appreciate you having me on.
And thanks to our audience for tuning in. We'll have everything that Dr. Maljaars mentioned and other helpful resources linked below. Thanks for listening.